I suffered a fall approximately 3 years ago and didn't break anything, but had sprains. I had a sprained ankle, sprained knee, sprained back, had two surgeries, and as a result, I now have chronic back pain and hip pain. I have done everything, medically indicated, and now was at the chiropractor, and he thought by losing weight that would alleviate some of the pressure on my back. I didn't really take him seriously at first, but when I went back the second time, he started giving me brochures. I was like, okay, he's really serious about this. He wants me to really think about that. Then I had to kind of really think about the fact that obesity is a disease. That was something, a thought process that I just had never ventured to think about before, that this really is a disease and that I'm a person who is afflicted by this disease and have been afflicted by it since childhood. So that was kind of a wake-up call for me that I needed to do something.
I think my wake-up call probably was when I realized that my quality of life was declining, and it was going down rapidly. I had diabetes. I had a lot of issues with my breathing, with asthma and joint issues, and life just was not a whole lot of fun to live anymore. So I realized that for me to be able to be there with my kids and to do things with my kids and to just enjoy life, that I was going to have to do something because I didn't want to keep going the way that I was.
I live on a corner house, and I was sitting outside with my son, who was just learning to walk, and we were sitting on the lawn and just playing, and out of nowhere he jumped up and ran towards the street. And the amount of time it took for me to get up and run after him, he was already in the street. And I realized that I wasn't there to protect him, that I couldn't do it at my weight. So at that moment, I knew that I had to do something so that I could be there for him. He was only 1 year old.